Welcome to the Ovation Show, where we are discussing the healthcare crisis in America. We're bringing partners, colleagues, clients, and business owners together to discuss solutions and innovations that bring a higher quality of care to employees and reduce their out-of-pocket costs. But we're also reducing the employer costs, giving them more transparency and control. Today, we are live in the Work Innovator studio, where Work Innovators is amplifying the voice of business at the VentureX in Castle Hills, located in the Realm. Today, we're going to discuss innovation in the healthcare space around telehealth and telemedicine. And with that today, I've got Rey Colon, the CEO and founder of MyTelemedicine. A little bit about Rey real quick. I mean, I met him back in, I think, 2008 when he started AmeriDoc. You were there for 4 years. You sold that, took a little brief hiatus, and came out and started MyTelemedicine. You guys are just killing it in your space now. I think a couple things. You've got your number 50 on the Inc. 5,000 regionals list in Texas, that you're one of the fastest growing businesses in Texas. You got a technology grant recently from the city of McKinney. Number 1,112 on the Inc. 500 list this past year as well. I know that your company is growing. You just moved into that great new space in McKinney. Yes. You're talking about doubling your employee size over the next year, and you just doubled your office size. I just saw it advertised the other day. Yes. So, all right, everything's going on with you. You're killing it right now. So, Rey, welcome. Thanks for coming in. We've been friends for a long time. Tell me, I guess, how you got into telehealth and, kind of where that came from.
Yeah, well, first of all, thank you, Dan, for having me. It's just a great, everything kind of came together. My background is marketing communication. So originally in the South Florida area, I had a marketing company, and one of my clients was in a healthcare space, and he approached me about a new idea he had. And this was 2008. We were sitting at a Starbucks, and we had a piece of napkin and kind of started drawing it out. And, a couple of months later, we started AmeriDoc. And he understood the employer space well. We just continued to grow from there. And it really attracted me because I love the online vertical. That's really my passion. It was the internet, especially back then. Leveraging technology and delivering it online was just a great integration tool.
Well, I remember, when I started doing telehealth, we were an early adopter. I mean, we were pushing it out there, and people didn't understand it. They didn't believe you could even do doctor visits by the phone. And that has changed so much now. In fact, I think they said, in 2019, less than 0.3%, less than 1% of doctor visits were done virtually, and now it's 24%, and that's growing immensely. So you have MyTelemedicine now. How have you seen that growth and the utilization of telemedicine in the last year or 2 years, and since you started telehealth?
Absolutely. Well, it's in parallel to building out the technology, we also built out a national network of providers. So we have everything from board certified physicians to psychiatrists and psychologists. 10 years ago, when we first started this, it was a really tough sell to the provider. Was it legal? Can I do this? Can you even prescribe and diagnose somebody without actually seeing them? So there was a fight early on. And of course, you had forward-thinking physicians that were always willing to try it. They did their own due diligence with their legal, and they were able to do it. And of course, fast forward now to where we're at, I got to tell you, Dan, we're getting every day providers are reaching out to us. They want to join our networks. Before we had to solicit. Now we're being solicited to join our networks. And it is because, number one, throughout this whole time, Dan, guys like you and me, we've always used this one term whenever we're talking to potential clients, is the paradigm shift. Yep. When is that paradigm shift going to occur? One day we know that everybody will be using telemedicine. Unfortunately, it took a global pandemic to bring it front face. And what's really exciting about that is that it's really determined that technology can really change the way we leverage healthcare. So across the board, we're seeing members use it more, providers using it more. Most of our doctors that are in our network, they're either ER physicians, they have their own practices, and they're even saying that their patients are now complaining when they ask them to come back to the office because they're saying, for the past year, you've been able to see me virtually. Why do I need to come in now? Right. So it's absolutely changed, and it's going to continue to change. But what's really important is this allows us to really manage our healthcare. Right? We can be proactive with our healthcare, leveraging technology rather than reactive because it was inconvenient to manage our healthcare.
Well, I think we talked too about, productivity in the workforce and being able to manage healthcare. And guys are the worst. We don't go to the doctor. We don't want to sit in an office. We don't want to waste our time. And having the ability to get on the phone, I think also increases the the quality of care and actually people getting the care they need. For people that don't know, telehealth, I mean, you talk about the provider network that you have and these doctors. Just describe how telehealth actually works from the inside. When somebody calls in, to what happens behind your scenes.
Correct. So the entire experience is handled virtually. So if you just think of a normal office visit, you go there, you fill out your HIPAA forms, right? They give you the clipboard. Then a nurse finally calls you back. She kind of gets tell me what's wrong. Why are you here today? And she jots everything in her little file or folder, or now electronically. And then eventually a doctor comes in and he now sees you, and 2 minutes he's speaking to you, and then he's out of the room. A prescription's done. And now you have to go to the CVS and pick it up, or your pharmacy of choice. So that entire experience is now digitized, right? We have care coordinators that are at our corporate headquarters 24/7, 24 hours a day, 7 days a week, 365 days a year. And these care coordinators will answer calls, and they will do that intake process. If a member doesn't want to call the hotline, they could download the app. They can also go online, and they can, through a HIPAA secured platform, log in and go through that entire experience virtually, sign HIPAA informed consent forms. They can update, tell us what's wrong. They can update their own medical records, then get connected to an actual physician. And this physician has a historical record of them. So they see every single consult they've ever done on the system. They see their previous history, any medications that they're taking, any allergies they're taking. They also see their medical condition. So this doctor has a full scope of view of the patient. And now when he's talking to the patient, either by phone or by video, he can now properly diagnose this member based on their symptoms. And then, if need and appropriate, he can also then electronically send a prescription to the pharmacy of their choice. So the reality right now is we have a national callback return time of under 19 minutes. Wow. So from the time you say, I want to schedule a session, within 19 minutes on average, we're getting a doctor. And these are board certified licensed physicians, licensed in your respective states. And these doctors will be able to provide that advice, guidance, and even diagnose and send that prescription to the pharmacy of your choice.
It's just such an outstanding service. And, like I said, we gravitated early on, and now we've got clients that put it in as a standalone. Maybe it's the only benefit they give their employees. We see that with a lot of part-time franchisees, seasonal type of employees. The employers get it. And it's very inexpensive to offer. One thing I know is, we've taken away the co-pays as well. So now it becomes a free service for the employees to use. So as an employee, hey, I have no co-pay. It makes even more sense to use it. And so we're driving that utilization. One of the things I know, we talk about medical, and we're talking about getting in, hey, I'm going to get a prescription. I have an ear infection, sinus infection. But you've also seen a big wave, and you're one of the first adopters to put in behavioral health. Talk a little bit about what that is.
Well, absolutely. Nowadays, and over the recent years, behavior health is an issue that has been around for a long time, but everybody had put this stigma over it, and now it's become more popular. So what we did in parallel to building out a network full of just medical doctors, we said, well, let's build out a network of therapists, of psychologists, of psychiatrists, of counselors, and let our members be able to speak to those providers based on their schedule. You can talk to a therapist, a master level therapist, on demand, 24 hours a day, 7 days a week. If you feel like you need something higher, you can schedule an appointment with a psychologist or a psychiatrist. And these providers are now able to manage you ongoing. And this is really important because a lot of times when you're dealing with mental health related issues, and this month is National Mental Health Month, it's sometimes people are embarrassed. Men, for example, right? We put a lot on our shoulders just as women, and, kids as well. We deal with society as it is today, and we're fearful of someone knowing that we have some issues with our mind. And mind is part of our body, and we need to take care of our body. We go to the gym. Well, we need to work our mind out as well. Mm-hmm. So what's great about behavioral health from a telehealth perspective is that it's private. You don't have to go to a psychiatrist's office. You can talk to a provider when you want at your schedule. And again, if there is a medication or a treatment program that is suggested, that provider can also do that and be able to see you based on your schedule.
Well, I had somebody that used it recently, and they told me, they said, it was great to have somebody to talk to. And I think we're, especially with COVID, people got locked up in their houses and maybe they couldn't even go. If they had a therapist, they couldn't go anymore. Some therapists didn't have the system set up to do virtual, and people forego those visits. Or we had more people now with issues because they're getting depressed, they're locked up, lack of interaction. So having someone to talk to over the phone is great. We have a home healthcare group that's one of the clients, and they have it because they said their employees deal with a lot of death and sickness. And they want someone for their employees to call after they experience something to help them deal with that, maybe perhaps that pain of someone they've worked with for years. So it's a great option for them. Another innovation you've done, which is new, is Go Lexi, which was crazy, but people want it. Talk to us about Go Lexi, the virtual pet care that you've added into your system.
Yeah, well, just how that came about is our technology. Our infrastructure was built so it could be SaaS enabled, meaning that if a provider came in and wanted to service their own patients, have their own kind of business model, leveraging our technology, we can support that. So even though we provide the service of letting members talk to patients and to doctors and psychiatrists, the reality is it's a system that lets one communicate with another. So what we started here from the chatter, especially in the employer world where employee benefits focused around your pet, was becoming very popular. It was becoming requested more. Yeah. I mean, not only are we stuck in our home, but now essentially a lot of people, their pet's their best friend. Right now, you're with them all the time, right? And you're seeing the rise in pet insurance, come about. So, several of our clients, several of our partners says, hey, we have a need in the veterinarian space. So what we started to do was, again, we started to poll veterinarians to determine if there would be interest in being part of a network. And then we rolled out a network on a national level that allows consumers that are pet owners to be able to talk to a licensed veterinarian. Unfortunately, because of state guidelines, there is no diagnosis, there is no medication. However, I'm a pet owner, and there was one time when it was 2:00 in the morning and all of a sudden my dog was gagging and it just kept on going. It wasn't like, here, take some water and you're better. I had to, because I didn't have somebody I can communicate with, I had to now go to an emergency room in the middle of the night. And the reality is there was something that I could have taken over the counter that would have helped her. Yeah. So just like your child, just like yourself, people want to be able to have access to a veterinarian when they need it most. And we had a great response. It's a totally separate entity, a totally separate network. But again, it's pushed through our partners and it's pushed to our client base. So great response, a great product that's in need. So we wanted to just continue to service the market.
Well, I laugh about that because I had 2 dogs and I have a friend that's a veterinarian, so I used to bug him at all hours whenever there were questions. But one of our dogs got into a big bag of chocolates and ate like 100 Hershey Kisses. And so of course dogs aren't supposed to have chocolate. We're panicking, freaking out. Is the dog gonna be okay? So we called my friend Lucky. He said, well, put her outside in the backyard, see what happens. And so we watched the dog. Dog was fine, but you could tell visibly uncomfortable. Well, after it took a bunch of tinfoil dumps in my backyard, tinfoil filled dump, dog was okay. Yeah. But I was lucky. I had a vet friend I was able to go to. And so I can see now where if I have Go Lexi, how that will help too in those emergency situations where I don't want to go spend $1,000 at the pet ER. But at least I have someone to talk to, and they'll tell me, "Hey, take it to the ER." So I think it's great.
Exactly. What we all want is peace of mind.
Yeah.
Right. And oftentimes, what do? We go on Google. We start doing research. We don't know if it's an ad, if it's a promotion, if the site that we're getting the information is legitimate advice or not. So this gives you that peace of mind knowing that you can immediately connect with the veterinarian and speak to them, and they can let you know. Yes, it's something that you need to run to the emergency room. It's something that you can wait till the morning and schedule a doctor's office visit. Or you know what? Hey, it's something that over the next couple of days, it'll just naturally go away. Here's what we just suggest. So having that advice gives you peace of mind.
Well, I never thought about that, but I think telehealth, behavioral health, all of those pieces give their peace of mind in all aspects. And it's a comfort knowing, hey, there's someone I can get hold of 24/7, because there's nothing worse than being sick on a Saturday or Sunday and going, doctors aren't open. I can't go anywhere. And what are your options? Maybe urgent care, or maybe the ER when you don't even need to. And that's added cost to the employer's health plan. It's added co-pays and costs to the employee. So you're giving an option and peace of mind to be able to take care of that, take care of their family. I love it. Going back to, we had talked about, the network of doctors and how COVID changed things. And I know when COVID started, a lot of physicians had to figure out suddenly, hey, I don't want virtual care. I don't do virtual care. Suddenly they're thrust in, I have to do virtual care because I have to see people to take care of them, but also so I can get paid, because I'm not going to make any money if they're not coming in my office. Right. So doctors started having to find a way to do virtual care. And I know the government allowed them at the time to do, maybe even still it's going on, but to use FaceTime, to use Zoom, because of the urgency of the situation. But none of those are HIPAA compliant, and those are going to go away where they're going to start getting more regulated again. And doctors are going to have to figure out, how do I communicate with my patients going forward, because a lot of patients aren't going to want to go back in the office. They're going to want to keep their virtual care. So, you created a solution to help doctors. Talk a little bit about that.
Yeah. So in the fourth quarter of 2019, we started to see the uptick in providers wanting to use this in their day-to-day modal. Fast forward 4 months later, and all of a sudden we're in this global pandemic. So all of our development team is in-house. So we started immediately on the development of some new modules and some new feature sets. And we created a new company, a subsidiary of MyTelemedicine, called Xavier Health. And Xavier is a SaaS-based solution that we can license our technology to individual providers, to small to medium-sized practices, and to hospitals with multiple locations. And this is a platform that allows them to upload their providers, to upload their care coordination teams, nurses, to upload their patients in minutes. And now they can administer and treat and manage their own patients utilizing our platform. And this is a complete platform. So you said something that's really important. We have over 1,000 providers in our network, and we polled our network, and the biggest part that they have is most of these guys are using a Zoom or a DoxyMe-like solution. Well, these are just video engines. And if you notice, normal business people have multiple monitors. Well, most of these doctor practices are working off of a laptop. They're working off of a tablet. And, they need more tools in front of them. So Xavier is a full end-to-end virtual care platform. It has everything from a patient dashboard to e-prescribing modules to electronic medical records. It has treatment databases. It has merchant processing and even reimbursement management. So with our technology, what you're going to see is providers are going to start to realize, especially once the wave of the pandemic starts to simmer down, you're going to start to see there's going to be audits to ensure that you're seeing patients utilizing HIPAA secured platforms. And they're going to want a solution that they're going to want to treat more patients virtually. And if they're treating more patients virtually, why utilize multiple solutions? So Xavier is a full end-to-end virtual care platform that allows providers independently, or practices or hospitals, to see their patients and have a complete one experience platform.
I think it's great. I mean, you've done so much in such a short time too. I mean, so you've got the employees covered, giving them care when they need it the most, and basically at a cost they can afford, which is basically free. The employers are able to offer this to employees, which it's a low cost to them, allows them to take care of their employees, keep the employees productive, because really they can make a phone call while they're at work and not have to leave and go to a doctor's office. Exactly. You're solving the physician problem. And then you got the family taken care of too, with the pets, and then you got the behavioral health. I mean, you're just you really have it all buttoned up really nice lately. Just so excited for everything that's going on. And that's one of the reasons, we partnered with you a long time ago with AmeriDoc, and then back again with the MyTelemedicine. People don't know, we have OvationTelehealth.com. You go on there. That is, MyTelemedicine is our backbone. That does everything for our clients. So it's been really exciting working with you guys and watching this growth. You've got an amazing team with Wayne Orchard and Lorenzo. Yeah. Go Sox, go Pats. That was for you, Lorenzo. But a couple things. I wanted to go into something a little bit different here, though. First of all, you're a guy about service too. I mean, right now you're taking care of employees and employers and doctors and doing all that. But you're a U.S. Army veteran. Correct. So thank you for your service.
Thank you.
But something else I saw recently. Tell me a little bit about Xavier's journey.
So, it was brought to our attention. We have, close to 40 care coordinators on our team. And, it was brought to my attention from one of our care coordinators, Marcella. and she said, hey, there's a young kid in our town who he's been diagnosed with cancer, and the family's just been, because of the treatment, mom had to stop work so she can consistently deal with the son. Dad is really now kind of bringing in all the income, and even at times he needs to take off because sometimes they have to go to these, there was times when he had to go 3-4 times a week for treatment. And sometimes they even had to go as far as San Antonio for some of these appointments. Not only that, but then they also had the medications and the treatments and the costs associated with it. So when it was brought to our attention, just really laid on my heart that, we are fortunate. And I've personally walked through a season like that, but I know what I could only imagine looking at my child and seeing them walking through that, and knowing as a dad that I can't go to his appointment or hold his hand because I have to be at work. So when that story brought to me, it really hit home. And what we decided to do was get behind the family and let them know that, hey, we want to support you guys in any way we can, not only by just giving them access to our service, but, really financially as well. We wanted to be there. We are in a good position, and we are blessed to continue to do what we did. Our story as a company has always been driven about the patient experience, right? And as the market of virtual care continued to enhance, we were able to build technology that matured and growed with the market, rather than it's just a video service and that's it. So again, we want to be able to pay it forward, and whenever there's opportunities like that to give back, it just makes us feel good as a company. And that's our culture as a whole. We want people to service our patients and our members to the top, to have a great experience, but we also want to give back. And it was really important. And I got to tell you, when I met this young man, Xavier, he's 6 years old, and he's probably been through some of the worst things that any child can experience. And he had such a smile on his face, so happy. It just was like a wow moment, and it really put things into perspective. So as we continue to grow, it's important to realize that we want to support our community. We want to support other people that are not in our situations. And if we can be a blessing to others, then why wouldn't we take that opportunity and do so?
That's awesome. I mean, I'm sure they love everything you're doing for them, and it's such a great thing you're doing. You've shown us today, you're an innovator, you're a leader of your industry, and you're a community leader. And we need more of that around the country. So thank you for everything you're doing, and providing this great service too. So, I tell everybody, if you're looking for telehealth for your employees, be sure to go and look at MyTelemedicine.com or go to OvationTelehealth.com. Look at the options. Where either one of us are happy to talk to you about implementing this into your company. And again, it's inexpensive. I mean, a cup of Starbucks coffee a month, and you can take care of your employees and give them a great access to great care. So
absolutely, yeah. And working with you as a partner, Ovation Health, what you do is great. You help us manage our employee benefits, with our insurance, with our dental, even the telehealth aspect of it is part of it. But, it is really about giving back. So we're excited to just continue to move forward with partners like you guys. And, telehealth is the future. Yeah. I think it really brings accountability into the equation, and it lets us manage our health conveniently. And put it importantly, we manage our credit, we manage our bank accounts, right? We manage to go to the gym or stay healthy. Well, now it's time that we manage not only our body from an internal perspective, but our mind as well.
Well, and I think one of the keys too that I forgot to mention was, the ease of access to all of this. Something that we've done, you've got the Access a Doctor app. We have our Ovation Benefits app. And through Benazon. Mm-hmm. And so our clients get that app, and it has a direct link to MyTelemedicine. You push a button and you're linked to telehealth, where you can get the service you need with the click of a button. So it's fantastic.
Exactly. It is. It's at your fingertips online through a mobile app. Or best of all, if you're not a technology person, call the 800 number and you're going to talk to a care coordinator who's going to be able to assist you.
Fantastic. So Ray, great having you in here. Yes. I appreciate it, man.
Thank you very much, Dan.
It's awesome.
Appreciate it as well.
And real quick, so we want to thank our sponsors, Success North Dallas, where they've been connecting people for over 30 years. And then Craig Shelley, Beverly Hills, luxury watches and fine jewelry. Thanks for having us, and we'll talk to you next time.